Have you ever had one of those coughs that just hangs on for dear life? Maybe you're feeling a bit of that chesty congestion, you're just totally wiped out, and you're starting to wonder what's really going on. Well, we're going to break it all down for you, starting with the basics of bronchitis. It's so frustrating, right? You finally kick a cold, but then this awful cough decides to move in and stick around for weeks. It's a super common concern, and it definitely makes you wonder, is this still the cold or is it something else? Let's get to the bottom of that and really understand what bronchitis is all about. So let's get right into it. What exactly is bronchitis? Well, at its core, it's all about one word: inflammation. And specifically, inflammation happening deep inside your airways. Okay, so picture this. Your bronchial tubes are like these little highways that carry air down into your lungs. They're essential. But with bronchitis, those highways get irritated and inflamed. And just like a real highway, that inflammation causes a major traffic jam for the air trying to get through, which, well, it makes everything a lot more difficult. So this irritation kicks off a whole chain reaction in your body. First, the airways start to swell up. Then your body goes into defense mode and produces a ton of extra mucus to try and protect everything. And it's that 1-2 punch of swelling and all that extra gunk that narrows the passages, limits airflow, and gives you that classic cough and that tight feeling in your chest. Now, this is a really important distinction to make. There are actually two types. First, you have acute bronchitis. This is the one most of us are familiar with. It's short-term, usually caused by the same virus that gave you a cold or the flu. Then you have chronic bronchitis. This is a much more serious, long-term condition that's often tied to things like smoking. It's actually a type of COPD. So for the rest of our chat, we're going to focus on that much more common acute kind. Okay, so we know what's happening on the inside, but what does all that inflammation actually feel like? It's good to know the usual signs, but it's even more critical to know the red flags, the things that tell you it's time to call a doctor. I'm guessing this list looks pretty familiar to some of you. That cough that just won't quit is really the main event, and it often brings up some lovely mucus. And that feeling of tightness in your chest, being super tired, maybe even having a slight fever? Yup. All classic signs that your body is in a full-on battle with that airway inflammation. All right, now pay close attention here because these are the symptoms you absolutely should not ignore. If you've got a really high fever, if you feel like you're getting more and more out of breath, or if you have actual chest pain, those are serious red flags. It could mean something else is going on, like pneumonia, so you've got to get it checked out by a doctor. Now for the good news. Since most cases of acute bronchitis are temporary, the name of the game is really just managing your symptoms while your body does the hard work of healing. So what does that actually look like? This is probably the number one question on everyone's mind. You feel terrible, you've got this awful chesty cough. You must need an antibiotic to knock it out, right? Well, let's see what the facts say. And the answer, almost always, is no. It all comes down to a really simple biological fact. Antibiotics kill bacteria, not viruses. And since the huge majority of acute bronchitis cases are caused by a virus, the same one that gave you that cold, antibiotics are basically useless. They just won't help. So instead, the focus should be all about making yourself comfortable and giving your body what it needs to heal. Rest is not optional. You got to do it. Staying hydrated with lots of water helps thin out all that mucus. Using a humidifier can feel amazing on your irritated airways, and things like warm tea with honey can really soothe a sore throat. And here is a piece of information that will save you a lot of worry. That cough can stick around for a while, even after you start to feel better. I know, it's super annoying, but it's a totally normal part of the process. It just means your airways are still in the final stages of healing and clearing everything out. And just a quick reminder about that other type we mentioned, chronic bronchitis is a whole different ballgame. That's a serious condition that absolutely requires a doctor's care and often involves things like inhalers and, most critically, quitting smoking. Of course, the best treatment is not getting sick in the first place, right? So let's wrap things up with a few simple, powerful steps you can take to protect your lungs and lower your risk of getting bronchitis altogether. Think of this as your personal lung protection plan. Number one, and it's the biggest one by far, is to avoid smoke. After that, it's the simple things that make a huge difference. Washing your hands often is a game changer for stopping viruses. Staying current on your shots, like the flu vaccine, can prevent the illnesses that lead to bronchitis in the first place. And, just taking care of yourself with good sleep and nutrition helps your immune system stay strong.
Phew, okay. That was a lot to cover. So let's just boil it all down to the absolute most important things you need to remember.
So if you take anything away from this, let it be this. Bronchitis is just inflamed airways. The common type is almost always caused by a virus, so rest and fluids are your best friends, not antibiotics. Keep an eye out for those serious red flags like a high fever or chest pain. And remember, taking simple steps to protect your lungs is one of the best things you can do for your overall health. So, I'll leave you with this final thought. Your lungs are working nonstop for you, every second of every day. Taking just a few simple steps to help them out isn't just a good idea. It's one of the best investments you can possibly make in your health. Thanks for watching.